Can these $100 devices help your tinnitus? I ordered a pair to find out. This right here is the TooPower rechargeable noise cancellating hearing aid, and they say it has a tinnitus masking mode. I know, working with my patients, that sound therapy, also called tinnitus masking, can help promote a natural brain process called habituation, which eventually helps reduce your tinnitus over time. Here's what the TooPower devices claim to do on their Amazon page. They say they have 3 modes: normal listening, party mode, and tinnitus masking mode. Now, typically these devices that go in the ears, they'll create different environments, so you can click a button through the app or on the device and it will change the audio information that you hear based on the environment, because certain noise cancellating features are beneficial when you're in a noisy place, and if you're in a quiet place, you might actually need to hear people more clearly with a little bit more volume. That's why these types of programs exist. The tinnitus masking mode particularly caught my attention because if the sound therapy was any good, then these devices being $100 actually could be a good value. So I wanted to explore it on my own, and that's why I bought these. I have mild tinnitus and I don't have hearing loss. I gave the TooPower devices a try, and what's notable is that they fit into your ear canals like an earbud. They're completely blocking your ear canal. And when they turn on, they provide a rush of amplification. As I'm hearing it in my ear right now, my own voice sounds very distorted. It feels like I'm in an echo chamber. And overall, the sound quality is not very good. I even took these on the street, as you can see here, and felt very overwhelmed by the road noise. Even when I made adjustments to the devices, it was not comfortable. I couldn't really find the correct fit for me. Now, keep in mind, I don't have a hearing loss, so even in the mild setting, I felt like it was a bit overwhelming. These devices claim not only to help tinnitus with the masking mode, but also with hearing and the ability to hear conversations more clearly. These devices claim to increase volume by 30 to 35 decibels, so for someone with a mild to moderate hearing loss, that's about appropriate. Now, in theory, here's how the TooPower devices might help tinnitus. They use a combination of amplification and sound therapy. Amplification addresses the underlying hearing loss component. If you have even a mild hearing loss, research has shown that treating your hearing loss can provide benefits for your tinnitus, not just in the moment when you're using the devices, but also long-term to promote that process called habituation, which reduces your tinnitus perception over time. The second component is sound therapy. And using sound therapy is a common recommendation. It mostly comes from tinnitus retraining therapy. These devices, when they're using a tinnitus masking mode, that's not saying that you should cover your tinnitus when you're considering using sound therapy or masking. Instead, we want to have that sound therapy below the level of your tinnitus so that it can mix in nicely and help with your attention, your concentration during daytime hours. So that can provide some immediate relief for some people. But on top of that, it also promotes habituation. Having that low-level sound therapy trains your brain that constant neutral sounds are something that it can learn to ignore and push into the background of our mind. And over time, the brain does that automatically, subconsciously, to your tinnitus. So that's the theory of how sound therapy and hearing aids help tinnitus. I see that with my patients all the time, but this $100 device, it almost seems too good to be true, right? But what about the tinnitus masking feature? So overall, in that tinnitus masking feature, they're playing a white noise, and I was able to adjust the white noise. It wasn't horrible, but here's the thing that they absolutely got wrong. To market this for tinnitus masking, it's really only meant for people who have a moderate or worse degree of hearing loss and across all the pitches. As an audiologist, here's what I look for in a quality hearing device for tinnitus. I need the sound quality to be excellent, the size to be sleek, ideally up and behind the ear. I need a rechargeable battery with a long battery life, and I need the ability to program and fine-tune those devices for both tinnitus and hearing loss. How do these $100 devices compare to the high-end professionally fitted hearing aids? Well, I'd like to share some of the pros and cons. The main thing to consider is that these TooPower devices are over-the-counter and are not programmed to your specific hearing loss or tinnitus. That's very important because research shows we get the best results in your tinnitus treatment and hearing loss treatment when we can program the devices according to your hearing test and other relevant information. Also, it's very necessary to change the settings and optimize and fine-tune them over time, no matter whether you're working with an audiologist at a local clinic, our team at Treble remotely, or doing them on your own, you do need customization, and ideally that's a professional who can guide you through that, because we change the program settings on our side and we have a lot more handles and knobs and experience of how to optimize whatever devices you're using for your tinnitus treatment. In my experience, my patients have the best success and can reclaim their focus, concentration, and get help with sleep when we fine-tune medical prescription type devices on their ears based on their hearing tests. So that was my recommendation for anyone who's listening, is that these cheaper online devices, I wouldn't necessarily recommend them. Over-the-counter hearing aids, not all of them are bad, but almost all of them are not for tinnitus, because there's certain tinnitus features in there that just aren't allowed inside of over-the-counter hearing aids today. Another very important piece is to educate you on something called the occlusion effect. So when these devices go in your ear canal fully, they block your ear canal. So there's no natural sound coming in, there's no natural air leaving or coming, sound waves bouncing in or bouncing out. Everything that comes through this device is processed and the speaker outputs the sound into my ear canal, and then it's like a closed chamber. All that sound is going into my ear canal. And what that creates is this feeling like I'm in a box, this feeling like I'm in this reverberant chamber and I can't hear so clearly. My own voice sounds very strange, and my ear has a bit of pressure to it. For tinnitus, that is a very bad thing. Unless you have a significant degree of hearing loss, you should not be closing your ears like this for tinnitus treatment. And I often say to patients and folks here on our YouTube channel that you should be cautious with using headphones, over-the-ear headphones, earbuds, certain kinds of AirPods that close your ear canals as your primary sound therapy. I wouldn't recommend that. If you're dealing with tinnitus for more than a few days, then you likely need something that's going to keep your ear canals open. That's what I recommend because it works the best for my patients and our community. So that means using sound machine, using the speaker from your phone, using tinnitus sound therapy devices that go on the ears, like the ones that our team provides at Treble Health. Any of those are a great option. Even hearing aids for tinnitus are also excellent. So that's just some nuanced information that I hope helps you make your decision of, what kind of devices out there are for me. And in my experience using these devices in my ears, it wasn't a successful one. About a year ago, I remember a patient of mine who struggled with tinnitus for months on their own. And when they tried a similar device, they were hopeful they found a good deal on something that could provide them relief. I learned that my patient tried the devices for about a week, and their experience was that the sounds were overwhelming. It wasn't a comfortable fit in their ear. It blocked out all of their normal hearing ability, and then everything they were hearing was processed. So imagine hearing a metallic sound, a sort of electronic processed sound that isn't good sound quality all day long. Plus, if you have tinnitus, you know that when you close your ear canals with, say, earplugs, or you're in a very quiet room and there's not external noise around, you're going to hear an increase in the perception of your tinnitus. That's very common, and this individual also experienced that over a week period. They got in touch with me later. It was not a good week for them, and I would just hate for anyone to go through a similar process if they're considering online devices that can provide sound therapy or hearing aids that can help with tinnitus. I really want everyone to be mindful and considerate of the pros and cons. I don't want you to waste your money. So look, my patients that I work with are often trying online products, and they may see something that's appealing. They may spend $20 here, $50 there, and after about 3 months later, their problem isn't much better at all. They didn't pursue proper treatment, and because of that, they're struggling trying to figure it out on their own. I have empathy for this. I understand that we're looking for any help we can get, and sometimes we're in a very desperate situation. But I hope that this video provides guidance and education on, if it seems too good to be true, if it's closing my ear canals, if it's not a professional quality sound therapy device on my ears, I'm going to save my money. Instead of buying these devices for tinnitus, if someone only had, say, $50, a high quality sound machine and educational information from this YouTube channel, from Treble Health, on how to use the sound machine, how to also use other complementary tools like mindfulness and cognitive behavioral strategies, CBT, all of that together is going to lead to the better outcome. And if I can leave you with one big message of hope, it's to stay with it, keep going, do not settle for a life struggling with tinnitus, and take all the tools and resources you can, and I believe you can do this.